One coalition is bringing together over 600 medical professionals to target vaccine hesitancy. Our Teodora Mitov joins us in studio this morning with why this coalition says this is important. And Teodora, this is a time where a lot of people get sick.
Yeah, Kaylin, winter means colder temperatures and spending time with family and friends during the holidays, but that also means increased respiratory illnesses like RSV, the flu, and COVID, and gatherings like holiday celebrations can spread these viruses on greater scales. In fact, one doctor at Blank Children's Hospital says this is a concerning time for pediatricians like himself because of the increase of respiratory illnesses, but the spread of vaccine misinformation, he said, can have greater effects on our society.
We have seen a flood of misinformation specifically about the COVID vaccine. Do we worry that that's going to overflow and translate into hesitancy about other vaccines, other routine vaccines, measles, meningitis, diseases like that? Yeah, we worry about that. There's some signs that could be coming.
Dr. Boonstra is also the chair of Iowa Immunizes, a coalition created in late 2019 with the goal of providing accurate vaccine information. He said that during the pandemic, people were missing their regularly scheduled doctor's appointments due to wanting to stay home and not get infected with COVID. According to him, this also resulted in missed vaccine appointments, which he said can have major effects on society. He said that even a small dip in vaccine rates can cause a vaccine gap, which can make diseases spread. A concern he has right now is measles and how a dip in vaccine rates for measles is increasing cases. He also said vaccine hesitancy that resulted from misinformation on the COVID vaccine can further complicate this problem. That's why he and other members of Iowa Immunizes said coalitions like theirs are important for providing the accurate information on vaccines and directing people to resources.
We have over 600 members. We have over 100 organizations that work with us on this coalition to make sure that people have the most accurate and scientific-based information in a format that's easy for them to understand. And when you can speak as a coalition rather than just an individual, that just amplifies your voice so much more.
And right now they're encouraging people to talk to their primary care providers to find out if they're behind on any vaccines and to talk about any hesitancy people may have about vaccines.
Yeah, it sounds like communication is key in this, Teodora. So why is a coalition like this so important for Iowans?
Well, the World Health Organization named vaccine hesitancy one of its top 10 threats to global health. And on a state level, the executive director of the Iowa Public Health Association, Lena Tucker-Reinders, said that there have been attempts to change policy within the state legislature that can impact how people access accurate vaccine information. An example of this that she referenced is during the last legislative session when the mandate to teach about the HPV vaccine was overturned. So that's why, according to her, coalitions like this are important for providing that education to those who want to know more.
Okay, sounds like it goes way beyond just the COVID vaccine here. So good information there. We'll stay tuned to see what happens next. Teodora Mitov reporting live for us this morning. Thank you, Teodora.